Imagine this. You're lying in bed late at night, your stomach burning with discomfort. You think, maybe it's just heartburn. Maybe I ate too much spicy food. You pop an antacid, get some relief, and move on with your day. But what if that simple burning pain isn't just indigestion? What if it's a signal? Your body whispering that something deeper, more dangerous, is happening inside. That whisper could be an ulcer. Ulcers are one of the most misunderstood health problems today. People often dismiss them as minor irritations, but in reality, they are literal wounds inside your digestive system. Wounds that can bleed, become infected, or even tear holes through your stomach or intestine. And here's the scariest part. Many ulcers remain silent until disaster strikes. In today's video, we'll uncover the truth about ulcers, how they form, and what really causes them. The symptoms that people often overlook or mistake for something else. How doctors diagnose them and why accurate testing matters. And finally, the modern treatments that can stop ulcers before they become deadly. By the end, you'll not only know what ulcers are, you'll know how to recognize their early warnings and protect yourself or your loved ones. Think of your digestive system as a road. Food is the traffic moving along it. Normally, that road is smooth, lined with protective asphalt made of mucus and healthy tissue. But when an ulcer forms, it's like a pothole breaking open in the road. That pothole, an ulcer, is an actual open sore in the lining of your stomach, small intestine, or sometimes even your esophagus. It's not just irritated tissue, it's a wound that acid and digestive juices can eat deeper and deeper into. If ignored, that pothole doesn't just stay the same. It widens, deepens, and eventually breaks down the road entirely. In your body, that means bleeding, perforation, or infection. For years, doctors used to blame stress and spicy food. And while those factors can make ulcers worse, they're not usually the root cause. Science has revealed two main culprits. 1. Helicobacter pylori, H. pylori, a bacterium that sneaks into the stomach lining. This bug can live silently for years, slowly inflaming and weakening the protective mucus barrier. Most people don't even know they're infected until the damage is already severe. Fun fact, scientists Barry Marshall and Robin Warren won the Nobel Prize in 2005 for proving H. pylori causes ulcers. Before that, even doctors thought ulcers were just stress sores. 2. NSAIDs, non-steroidal anti-inflammatory drugs like aspirin, ibuprofen, or naproxen. These are great for headaches or arthritis pain, but they come at a cost. They reduce prostaglandins, the very chemicals that keep your stomach lining safe. Taking them on an empty stomach is especially risky, like driving without shock absorbers on a rocky road. 3. Other risk factors. Smoking reduces blood flow, slowing healing. Alcohol boosts acid production, stripping away the stomach's defenses. Stress, not the root cause, but it fuels acid production and slows repair. Poor diet, greasy processed foods can irritate the gut and make existing ulcers worse. Here's the tricky part. Not all ulcers scream for attention. Some whisper, others stay silent until the very end. Early symptoms. A burning or gnawing pain in the upper abdomen, often between meals or at night. Pain that improves with food, duodenal ulcers, or worsens with food, stomach ulcers. Bloating, burping, loss of appetite. Unexplained weight loss. Advanced symptoms when things turn dangerous. Vomit that looks like coffee grounds, partially digested blood. Black tarry stools, a sign of internal bleeding. Sudden sharp pain spreading across the abdomen, possible perforation. Fatigue, dizziness, pale skin, anemia from chronic bleeding. When these signs appear, the body is no longer whispering, it's shouting for help. Because ulcer symptoms can mimic acid reflux, gastritis, or even gallstones, self-diagnosis is risky. Doctors use specific tools to get clear answers. Endoscopy, EGD. A flexible camera goes down the throat to directly view ulcers. Doctors can also take biopsies here, checking for H. pylori or ruling out stomach cancer. H. pylori testing, breath test, stool antigen, or blood antibody test. These confirm infection but don't show ulcer damage. Barium X-rays can reveal large ulcers but less sensitive than endoscopy. Medication history. Doctors always ask if patients use NSAIDs, steroids, or other irritants. Accurate diagnosis isn't just about treating pain, it's about preventing catastrophic complications. The good news? Today, ulcers are highly treatable, if caught early. For H. pylori infections, a triple therapy of antibiotics plus a proton pump inhibitor, PPI, is prescribed. PPIs like omeprazole, lansoprazole, lower acid, giving the stomach time to heal. For non-H. pylori ulcers, acid suppression, PPIs or H2 blockers. Antacids for quick but temporary relief. Sucralfate can coat the ulcer and protect it from acid. For NSAID-related ulcers, stopping or switching medications under doctor supervision. Sometimes doctors prescribe additional protective drugs if pain relief is still necessary. When surgery is needed, rare today, but life-saving in emergencies. Endoscopic cauterization to stop bleeding. Surgery to repair perforations. Ulcers don't vanish on their own. They dig deeper, spreading damage over time. Many lives are lost, not because ulcers can't be treated, but because treatment came too late. Think of ulcers like a leaking roof. Fix it early, and the repair is simple. Wait until the ceiling collapses, and the cost is devastating. Every year, thousands of people experience preventable complications because they brushed off the warning signs as just heartburn. So, here's the bottom line. Don't ignore your gut. Burning pain, dark stools, unexplained weight loss. These are not inconveniences. They're warning lights on your body's dashboard. Early diagnosis and treatment aren't optional. They're life-saving. If you or someone you know is struggling with these symptoms, don't just reach for another antacid. Reach for professional help. Because ulcers may be silent, but they don't have to be deadly. And if this video helped you understand the hidden dangers of ulcers, share it with someone who might need this knowledge. Your share could be the reason they act early. Thank you for watching, and take care of your health. You only get one stomach.